My name is Raul Grijalva. I represent the 7th District in Arizona, and I'm co-chair of the Congressional Hispanic Caucus. We're at, and all of us know how important, those of us, my colleagues that are here, we're at a crossroads on health reform in this country. We're at a point where there is no retreat, and we can and we must hold the line. And what are we holding the line on? We're holding the line on the fact that we, from the beginning, have been promoting single payer, and in absence of that, and that's what happened, and we have to be, and we all have to be honest with each other. We are now saying that we must have a public option that is meaningful.
Yes. That's right.
That has Medicare as its provider network.
Yes.
That has Medicare plus 5 as its rate. That we don't negotiate with private insurance companies for the rate on the private option. And that this will not be paid off. This health reform will not be paid off the backs of small businesses, poor people, and working families. We are supporting what happened out of Ways and Means. We are supporting what happened out of Education and Labor, and we find what is happening in Energy and Commerce unacceptable. We're not obstructionists. We're advocates. We are here to advocate. We are here to advocate for the simple right of every person and every American to have an opportunity to have quality health care and a quality life in this country. We're not obstructionists. And we're not here to divide or embarrass our party. We are here to remind our party that as Democrats, we have some basic values. And one of those values is the care and the shared responsibility we have for each other. Well, I'm proud to be with the caucus. I'm proud to be with my colleagues today. It's about a robust plan. And it's got to be clear that we're not in the process of threatening people. We're in the process of affirming. Well, we told you months and months ago, leadership, administration, months and months ago. We're on this ride with you because of the commitment to a strong, meaningful, robust public option. If it's not there, we're not there. Thank you very much.
Stay for questions. Okay, stay for questions. We're going to go right into questions. Questions, yes, sir.
It seems like what we have now.
Say where you're from, please.
My name's Mike Stark. I'm with Fire Dog Lake. It seems like what we have right now is a game of chicken, you versus the Blue Dogs. And whoever blinks first is going to win. What I want to know is, it looks like a lot of the Blue Dogs and a lot of the conservative or centrist senators are from districts with things near and dear to them, like the Farm Bill. Are you willing to say if you don't blink first, you're not going to get something very important to you? If they're going to prevent health care?
All right.
Let me just, as part of a response, and I think it's important. We took the 7 members that are Energy and Commerce, that are part of the Blue Dog Coalition, and kind of looked at their districts collectively. In their districts, there are 671,000 people that are uninsured. 6,500 families lose their homes and their businesses because of bankruptcy, because of health care costs. We have over 3,200 people, almost 40,000 people that are trapped in that Medicare donut hole that with a public option would not be there. They're going to cost almost $1 billion or more of compensation for uncompensated care for their facilities and their providers. And there's 99,000 small businesses in those districts that would receive tax credit under a public plan. That's part of the strategy. That there is, sometimes we play too much chess here and don't talk enough with the public. I think the public, when they see this kind of information, are going to talk to those same members and say, give us a break too. Because right now it's about insurance companies and what they need. I think this month of August is about communicating with the general public in this country and saying, this is what's in it for you, and we have to put that kind of political pressure on.
Okay, next.